all the rules and regulations, OSHA and JACO and CLIA and all those things are there to ensure the safety of the people working in your building, that the building doesn't burn down, that smoke doesn't get into areas where it's not supposed to get to, that the fire extinguishers actually work, that someone actually knows how to use the dang things when something happens, that tripping hazards are not laid out like a minefield for your patients and or employees to trip over. It's all those small things that you worry about in your own home, burning down the house with the Christmas tree lights, making sure the kids pick up their toys, especially the ones that roll, etc. It's the same in your skilled nursing care facility. You have to be cognizant of all these pieces and parts, not because somebody's going to come inspect them to prove that you have quality care. It is so that you actually do have quality care in a safe environment for your employees and your patients. And if you deliver that safe, quality, compassionate care and you document it, you will never have difficulty passing those inspections, because that's what they're coming for. They're looking at the quality, they're looking at best practices, they're looking at how you solve problems. It takes too long, and this is a real this story, and I'll end with this one. Great story. The hospital administrator had never been to the surgical suite. Never, ever, ever. He's a hospital administrator, doesn't know anything about medicine, never wears a white coat, and had never been to a surgery suite in his life, even though he'd been working in hospitals for 30 years. And we were out on what is called a walkabout, which is trying to get the hospital administrators who live in an ivory tower most of the time to go out and see what the everyday employee and the everyday patient in that facility has to put up with, because not everything filters up properly and not everything from up filters down properly. So the walkabouts is a way for the administrators to go out and see problems. Well, this one was great because this guy was 6'4", big football player guy, even though he's in his 50s, still in pretty good shape, really good big man. So we got him up in scrubs and taught him how to wash his hands, and I'm with him because I'm taking him on this tour, and we step into a surgery suite that is being prepared for a patient. And this little tiny nurse, she couldn't have been more than about 5'1" and maybe 120 pounds if she was really lucky, was pushing a very old homemade plywood cart that had all the electronic gadgets on it that have come into play in surgery suites now. Now, 30 years ago, when this plywood cart was built, and it had little tiny wheels, so it didn't roll very well, and it was very heavy. When it was built, there was probably only one thing that needed to be put up on that thing, and the rest was just nice storage space for the surgery suite, and it was all properly painted and safe and infection control blessed, etc. But that was 30 years ago, but it's still in there today, with every shelf filled to the gills with the scope machines and the computer that runs the scope machine and the cauterizer and the anesthesia pieces and parts. And depending on which side the patient's having surgery, it has to be moved from one side of the room to the other side of the room to allow it to be used properly. So this little tiny nurse is just shoving this heavy plywood box with little tiny wheels up and around the operating table to reset it up. Well, the administrator, who's standing there for the first time, says, "Why in the hell haven't you gotten a new one of these things? This is ridiculous that you have to work so hard to push it." Well, that's all it took for that little nurse. She walked up to him, and remember, she's only 5'1" and he's 6'4", and she, hands on hip, through mask and goggles and the whole 9 yards, just gets within an inch of him, looks up at him and says, "Because you won't let me buy a new one." And he was shocked. His eyes got big. He said, "What do you mean I haven't let you buy a new one?" And she said, "I have asked for a new operating room cart made of plastic, bigger wheels, has all of the holes and whatnot cut into it for 5 years, and you always cut it out of the budget." He was speechless. Just speechless, because here is a piece of equipment that, yeah, would probably cost $25,000 because it's going to a hospital, but he never knew why that piece of equipment was important. This is what is called a quality process. His walkabout went down to the nuts and bolts of an operating room and saw something that was so obvious that needed to be replaced that when he saw it on paper in a budget meeting, he felt was useless or not as important as the next gas chromatograph or whatever the lab needed. But that $25,000 is a huge investment for the sake of the employees who don't have to push it around and their safety, for the safety of the patient because it's made of plastic and has all the right bells and whistles to keep things from going wrong, like electrical outlets and this, that, and the other. It would deliver better quality care. So this process improvement, he looked at it, he saw the process, and we said, oh, we need to fix this. So you go back and you look at it, you figure out how to fix it, you put the fix in place, and you come back a year later and say, did it work the way we thought it was going to? Well, in this case it did, of course, because it was a very simple thing. But there's lots of processes in any facility that can always be made better. So you're going to learn about that in week 9 and 10. Remember the stories. This is not just a building. This is not just a patient. This is not just an employee. These things are interactive. They have to work together. You have to communicate. You have to document. You have to get out of your office or out of the nursing desk or stop being a housekeeper long enough to say, how can we make this better for everybody, safer for everybody, so that good, compassionate care can be delivered all the time to everybody, no matter where they're at. Go out and study well. Have a good day.